Welcome back. Heart disease is the #1 killer of women. That's why every year on February 2nd, Go Red for Women aims to help women understand their risk. And here today is Dr. Anu. Thank you for joining us here today.
Thank you so much for having me and for raising awareness of heart disease in women.
Right. And so most women don't even know they can be at risk for heart disease. So what should they know?
Heart disease is quite prevalent in women. Nearly 45% of women over 20 years of age have some form of heart disease. More than 50% of women entering pregnancy are in suboptimal heart health. As you know, women experience life stages such as pregnancies and menopause, and during these stages of their life, they're at increased risk of having a cardiac event.
Right, and so how can they better understand their risk for heart disease?
Fortunately, the good news is up to 90% of cardiac disease is preventable through lifestyle changes. So you can adopt a healthy lifestyle, exercising, moderate intensity, 30 minutes 5 times a week, following a cardiac diet like a plant-based or Mediterranean diet, managing your stress levels, and getting enough rest and sleep at night are all important. Stop smoking, and also other risk factors like high blood pressure, high cholesterol, diabetes. Getting those controlled is very important. Now, there are also other non-modifiable risk factors that put you at increased risk, like your age, gender, race, family history. A great place to start to understand your overall health and risk factors is to see your primary care provider at least once a year. Now, if you have heart disease already established, increased risk factors, or just a strong family history, then it is important to see a cardiologist.
Right, and so what are some of those symptoms that women should be looking out for?
So the most common symptom is chest pain. When we say pain, it could be ache, pressure, tightness, squeezing, heaviness, shortness of breath, nausea, vomiting, indigestion symptoms, intense fatigue, sweating, legs swelling up, gasping for air, heart racing, and sometimes even feeling lightheaded or dizzy.
Right, and so as a female cardiologist, what's your message for this month?
My message for women this Heart Month is to really prioritize your heart health. Embrace a heart healthy lifestyle. If you have cardiac symptoms, don't ignore them and seek medical advice. Your heart deserves the same care you give to others.
All right, thanks so much for being here, Dr. Anu.
Thank you so much for having me again.
We'll be right back with a check of your forecast.